Okay, so constipation can be multifactorial. So there's a massive range, about 5 to 30% of children who do present with constipation. So it can be quite spontaneous, and different ages can present at different times with different symptoms. And that's where my job is to take that history and ask those specific questions. So is it related to behavior? Does the child have pain, for example, that they see this as a bad sign? It's something going on with their body that they're trying to understand, and that develops things like withholding, for example. Or is it down to poor diet or something that's not looking after good gut health? It's very multifactorial. There are some things that we would consider in the medical profession as red flags. And what that means is something that we worry about. And that's my job, to go through that history and ask those specific questions to make sure I don't miss if it's a secondary cause for the constipation. So at home, there's simple things you can do with constipation. Is firstly identifying, is this constipation? Because bowel motions for this child might be different to that child. So if the child is struggling, checking their diet, making sure they're hydrated, and making sure they are going to the toilet. That's some of the simple things that you can do at home. There's not a lot of treatment that can be done, what we say, conservatively without medication, if you're reaching somebody like me who has to manage constipation, because I'm more likely going to be doing therapies at home as well as helping with medication. So just the basics: make sure you're staying well hydrated and a good balanced diet, and checking in on your child's toileting habits. So if you're concerned enough about your child, then see a doctor. That is important. If you're worried, don't hesitate. Sometimes things can get missed if you're worried day to day. And if there is a bad diagnosis that could be identified at the end, you might regret not seeing that doctor earlier. So if you're worried, simple message: get seen. Specifically to constipation, I would be more concerned if there was some blood, for example, coming out with stools, or if your child was constipated and vomiting. These are two examples of other features of constipation that we would consider red flag in the medical profession. So if you're worried, get seen, and we can certainly take it on from there. Okay, yes, constipation can be caused primarily for unknown reasons, but absolutely it can be secondary to some nasty diagnosis. For example, something that may impact with the nerve supply to your bowel. So there's certain parts of the examination that we will assess not only the tummy, but we'll also check the nerves and might examine the legs, for example, to identify that. There are other causes, secondary causes of constipation. But that's where our history taking and our examination is important. So yes, there can be serious diagnosis with constipation being the primary presentation. Okay, so good habits are good hydration, looking after the gut. The gut loves to be hydrated. You also want to make sure you're using high fiber foods and fruit and vegetables, for example. So they're the simple things that we can do at home to look after our gut and try our best to prevent constipation.